My name's Deborah Lupton, and I'm at the Vitalities Lab in the Centre for Social Research in Health and the Social Policy Research Centre at the University of New South Wales in Sydney. And this presentation is about map making as a research method. Why choose the map making method? So this method is sometimes called participatory or citizen or sketch or freehand or mental mapping, but I'm just using the term map making as a simple term. And it involves asking participants to hand draw a map in response to your prompts. And your prompts will be related to the topic that you want to explore when you're asking people to make the maps. And usually you just give the participants pen and paper to make their maps. The benefit of making maps is that it allows people to think visually and creatively, and there's an emphasis on spatial and relational dimensions in the maps. They can work together collaboratively in small groups or work as individuals. The completed maps can be used as stimuli for discussion and reflection, and I think that's where they're really important. It's really important to talk to your participants about the choices they made in making their maps and to explain further the images and the connections that they drew in their maps. The project that I'm going to talk about that I used the map making method in was called the Digital Health Stakeholder Workshop. And the key research questions for this project was, how do Australians from a wide range of groups, including healthcare professionals and policymakers, as well as health consumers, conceptualise the landscape of digital health? How do people and technologies come together in this digital health landscape? What digital health technologies that are available in Australia work well? What new digital health technologies would people like to see invented? The theoretical background that underpinned this project and the analysis of the maps is more than human theory. This theory positions humans as always already more than human. They're constantly interacting with other living things in their environment and their worlds, as well as with humans and with non-living things such as places, spaces, objects. And as they are interacting with these living things and non-living things, affects are generated. And they're constantly coming together with these things and coming apart from these things as they move through their worlds through time and place. The process of doing a map-making project. First, you define your topic. What connections, relationships, people, practices, places and things do you want participants to incorporate in their mapping? You provide materials for participants, so usually it is just pen and papers. You ask them to work individually in pairs or small groups to draw a map. And the more participants you have, the larger the piece of paper should be so that they can work on the map together. Additional materials can be used for participants to add to their maps, so you can give them stickers or cards or other images that they can put on their maps. If working in a larger group, participants can be broken into smaller groups to work on their maps. Ask people to explain the decisions they made in drawing their maps. These discussions should be audio or video recorded so that you can refer to them later. The completed maps and recorded discussions are then the research materials for analysis. So you have the maps that you can use, that you can refer back to. You might want to take photographs of the maps. You have the actual completed artifacts themselves that you should keep, that you can refer to, and also the discussions so that you can move back and forth between these materials when you're doing your analysis. In the Digital Health Stakeholder Workshop, participants were provided with a large sheet of paper with people icons already printed on it. So there were patients, practitioners, community, industry, government, family and friends. Those icons were already on the pieces of paper we provided. They were asked to add cards with details of a specific digital health technology or other involved people or groups that we hadn't already specified that they could add to the map. They were then asked to use arrows to draw connections between people and the technologies to show the relationships between them. Each group then presented their map to the other groups in the room. And these processes were videotaped. So people working on the maps and also the presentations were videotaped so that I could refer to those later when I was doing the analysis. Analysis of the maps. What did I look for? So because I was taking a more than human theoretical approach to analysing what the people showed in their maps, these were the questions I was looking for in the maps. What kinds of technologies and people were included in these landscapes of digital health? What connections and relationships were shown between the technologies and the people? So which people were connected to each other, which technologies were connected to each other, and which people and technologies were connected to each other? How did the participants describe these relationships and connections in terms of how well the technology supported health and well-being? So that came to the point at which the participants presented their maps to the larger group and the kinds of things they said about the decisions they made when they were drawing their maps. And what were the gaps in connections and relationships that need improving? So again, referring back to what the people said about their maps, but also what they showed in their maps, there were interesting connections that were shown and interesting technologies and relationships that were shown, but it's also important to consider what were not shown, what were absent from these maps. The main findings. So what I found when I analysed what was shown in the maps and also what the people said when they talked about their maps, it became clear that some elements of the digital health landscape in Australia are working well. So there are strong connections, there are strong effective forces and capacities and agencies that are generated when people come together with these digital health technologies that are already existing. Digital health technologies have given health consumers enhanced agency to find and share their own information and access healthcare. This has changed relationships between lay people and healthcare providers. So some people did talk about how healthcare providers could be challenged or find their power somewhat undermined by health consumers using digital health technologies, for example, Google search to find information about symptoms before they went to consult a healthcare practitioner. But in other ways, those connections were strengthened so that some health practitioners did appreciate people actually going out and finding further information for themselves. Accuracy, efficiency and privacy issues related to collecting health and medical data require more attention, however. So there's a lot of concern in Australia about, for example, how electronic health records are being used at the moment, the My Health Record, electronic health record in particular, and to what extent the medical details that are entered into these health records are being protected by government agencies. It was also noted in people's maps that some social groups are excluded from participation. Of course, this often includes people who don't have ready access to digital health technologies or have difficulties using those technologies. And government needs to work more closely with industry, peak bodies and consumer organisations to develop better digital health resources and access. If you're interested in doing some further reading, I've listed here 2 outputs from my digital health stakeholder workshop that gives examples of how I did the analysis and of the actual materials that were generated, the maps themselves. And so there's an open access report that's available online called the Digital Health Stakeholder Report. There's also a journal article that I published in the journal Digital Health called Digital Health Now and in the Future, Findings from a Participatory Design Stakeholder Workshop, and that also includes some other methods that I used in this workshop. And there's 2 other sources listed here that have interesting findings on how other people have used the map making method.